Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about grand multiparity. And that is a woman who's had 5 or more babies, at least 20 weeks delivery. And I'm going to share a little bit of my experience with that too. So if you've had that many kids, there is a little bit of increase in the risk for almost all of the risks during pregnancy. So risk of diabetes, of high blood pressure, of growth problems, of baby going to the NICU, of anemia in the mom, low hemoglobin blood level, of poor growth in the baby, of a higher risk of a cesarean section. Part of this is because if you've gotten to that many babies, then you're probably older. So that may be a confounding factor where it's your age and those risks increase with age. The other thing, this is something that I've experienced, is that women who have that many children do well with pregnancy, and sometimes they get a sense of confidence that sometimes leads them to decrease prenatal care. A lot of what we do in prenatal care surveillance is watching for problems. And sometimes it doesn't always seem like we're doing all that much. And if you've had that many babies, you might not think it's as important, maybe miss some of the visits. And it does get important because you're at higher risk for those things, so we need to catch those things. So if you take anything out of this video, one of the important things is to remember, please continue with your prenatal care and follow. I do see a higher incidence of women who've had many vaginal deliveries, grand multiparity, with babies in the wrong position, malposition, or breech, backwards. Things have stretched out a little bit more, and for whatever reason, we do see it more often. So around 36 weeks, I'm pretty vigilant about making sure the baby's in the right place. If it isn't, then usually you're a pretty good candidate for external version. That's pushing on your belly to turn the baby. There's a whole separate video on external version to show you that. There's also a little higher risk that I've seen in my experience of cord prolapse. As you dilate, women who've had many kids before dilate more, and their cervix is around 4 or 5 centimeters dilated with the bag not ruptured yet, and the baby can be higher instead of low engaged. And if the bag of water breaks, then that can allow the cord to come out, and that can be an emergency that needs an emergency cesarean section. You can see my video on emergency cesarean section for that. So those high risk scenarios are why we encourage women who've done well with their pregnancies, who've had that many, to stick with their prenatal care and to be sure to be present near the end. I'm not someone who encourages home births, but I do see some women who feel confident with so many successes and decide to opt for that and don't recognize that they, despite their record of success, they're at higher risks for some of these events that just can't be well managed at home. Okay, so that being said, if you have a good track record, I'm not telling you shouldn't have kids past 5 at all. I'm just saying that you need an experienced physician, provider to take care of you, to be aware of those risks, and to take some of the precautions. You also can go faster, deliver faster. You want to deliver at home or on the car on the way to the hospital, so taking some precautions there, having a discussion on what options are available for you, especially if you live far away from the hospital, would be prudent. I hope you found these comments of help. Please leave your comments as well. Thank you.